Introducing the all-new Corolla.
GRMC CEO Maria Bengzon spoke to the GEDA board this afternoon in a last-minute push to get the qualifying certificate that would grant them tax breaks. Bengzon told the board that there's an opportunity for growth in the Guam healthcare market, as Guam's population growth is outpacing the U.S. mainland, and the population is aging. Older people are more prone to chronic diseases, which require more specialists. Meanwhile, Bengzon says Guam has about half the number of nurses and about a third of the number of doctors that the U.S. mainland has on average.
So what happens when you have a vacuum is that people leave. You don't have the services and people leave. And so we all know this. Every year, we estimate about 15,000 people, $65 million, leaves island for healthcare.
Bengzon says that the new hospital will help fill this healthcare vacuum and will help to keep patients who go off island for healthcare on Guam. They'll bring an additional 130 beds and 270,000 square feet of hospital. And Bengzon says they will take MIP.
We would take MIP whether the regulators require it or not, because that's just in our DNA. We see healthcare as an opportunity to do both well and good. And we want to do the well and good in Guam. And with the qualifying certificate as proposed, ably by the credit committee, we will be able to do that.
The GEDA Credit Review Committee recommended approval of the QC. Specifically, they recommended a 70% corporate income tax rebate for 20 years, 75% corporate dividend tax rebate for 5 years, and a 100% real property tax abatement for 10 years. GEDA's key reasons for this recommendation are the new medical services that would not come here without GRMC's investment, the tax breaks that will pay for those who cannot pay for health care, the boost it'll give to Guam's credibility as an area to invest in, and the $420 million in new tax revenues that Guam would otherwise not be collecting. Also, the GRMC will be paying direct community contributions that will be used to fund MIP, higher education, and other things as determined by the GEDA board. This contribution was originally set at 10% per year, but the board recommended a specific dollar figure that would increase over the years.
So 500,000 year one, stay with the 750 in year two, go to $1 million from 3 to 5, and then 1.2 from 5 to 10, and then 1.4 on out.
The board eventually approved this motion and approved the entire QC.
All in favor of that motion?
Aye.
Okay, the motion is passed, and that allows our administrator to proceed with working towards finalizing the document and signing on that QC.